as you say, the patients that comes to you, the first thing, of course, they're going to relate to your skills. It's like, okay, that's arthritis. So how does you get autoimmune patients coming to you? How would a patient land up with you, and how does it develop?
Okay. So basically, an autoimmune disease may not be like announcing its arrival. Here I am.
Yeah.
So a patient, for instance, with the eye, we talked about the eye, there's a condition called uveitis. All this person has is a red eye, blurred, painful. They think they have conjunctivitis. They get some drops, they put it, they go to their local GP. Then it keeps coming about, blurring of vision. And there's inflammation in the middle segment of the eye. There are all these white blood cells which are rushing there and attacking the middle part of the eye. So when they see a specialized ophthalmologist, they'll say, oh my God, you have this autoimmune disease,
Right.
and go see the rheumatologist. So they come to us, we run some tests, and then we start medication at that point. So we don't really know why people get autoimmune diseases. That's a little bit more tricky. First, people carry a genetic predisposition, like with every disease. For instance, with cancer, you might have a genetic predisposition to having this condition. And then there are triggers in the environment. There is bad diet, there's stress. Stress is a very big one. There is maybe a virus trigger or something. Like, now we have the COVID.
Yes.
And COVID, we see is triggering a lot of autoimmune diseases.
Yes.
When you've seen people having the severe condition in the lung, that's actually the immune system going into overdrive with COVID and attacking the lung. So they've used, no one knows this, they've used a lot of rheumatology drugs, drugs we use for rheumatoid arthritis to treat the lung disease in COVID. So actually, lots of our medications went out of stock last year because of this. And when we were treating our patients, we had a tough time. But it's so fascinating because people don't know the link between rheumatologists and things like viral diseases.
It's very true. I mean, like you said before, I think rheumatology relates to the bones and the muscles, but it's such in-depth